So next, I would like to invite up some experts in transition. So we have Jessica and Irvin who have been through transition and are going to help us understand sort of what that process looked like for them and tell us about successes and failures. And then Miriam, who is a parent who has been through and is continuing to go through transition in the healthcare system. So come on up. And just spend a few minutes telling us about what you'd like to share about your past and your transition, and then we'll open it up to the audience to share your experience. We'll start with Irvin. He's going to let ladies go first.
Hello. Good morning. My name is Irvin Bossy. I'm 21 years old, and I have sickle cell. Growing up for me was a little bit different than most people due to the fact that I had sickle cell. As I was growing up, I was told a lot of things that I heard was no, no, you can't do this, no, you can't do that, and it usually came back to you have sickle cell and all of that. So while I was growing up, one of the huge things that I was told that I couldn't do was my career choice. At first, I wanted to be an artist. They said no. Game designer said no, and then chef. They said no. At a point, I just came to a conclusion like, yeah, it's my life. I'm gonna live it the way I want to. And another thing that I strived for was independence. So the transition for me was pretty easy because as I was growing up, I started to take control of more of my life. Like I started to take more responsibility for things such as picking up my medicine from CVS. That started around like 12, well, I was 12 or something. Make my own appointments and coming to my own appointments by myself. That started as soon as I could drive, as soon as I was on the road. And the transition, that was all up to me too. And with the help of Dr. Barber, really wasn't that difficult at all. She gave me the list of doctors and places to go. I called them one by one until I found one that took my insurance, thanks. And I just signed up for an appointment, went over there, came back to Barbara, told her how it went, and then I've been going there once a month since then, and it's been about a year or so. So it really made it easy just because of my strive for independence. I wanted to take control of my life. I didn't want to live my life being kind of like babied and cuddled by my parents. That's really one thing that kind of irked me while growing up. So yeah, that's it. Thanks.
Jessica.
Okay, my name is Jessica. I'm 30 and I have sickle cell. And my transition happened about a year before I turned 18. Barbara and back then Dr. Benetti gave me the list of providers around the area who I would go to. So I ended up picking Washington Hospital Center. And thankfully, my providers over there have been wonderful. We've come up with an action plan. Um, they, I obviously went over there with my packet full of medical records and everything. One thing that I will say, as you become independent over your own stuff, it's really great if you are a great historian. They will ask you everything from your medication, your allergies, everything. Um, I my it was a little bit hard for us because my mother is an immigrant from here, so her English wasn't really good, and that was one of our barriers here, was that language. So as soon as I was able to communicate, I was the interpreter between my mother and our doctors. So it was easy for me once I turned 18 to be the historian, the clinician, my advocate, everything. um, I think it'd be good, as from experience, it's really good to be able to have a really great communication and with your primary care doctor as well, and as your with your hematologist. We came up with a plan that works for me because as you learn, when you go, I don't know if you've had the same experience, but when I go to the ER and I have a pain crisis, the first thing that it is, and it's really hard, is you're coming because you're a drug seeker. Unfortunately, I've had past experiences, and that was the first time that it's ever happened to me. Because here at Children's, they rely on your word. You know, they take it, they advocate for patients, for children. It's wonderful. But as an adult, you're completely viewed differently. So I came up with a plan with my physician that they have an infusion center. So I just worked out a plan that works for me, and it'd be different for everybody, but that would be great if everyone can also come up with a plan of action. Um, and other than that, thankfully, my crises have been down to twice a year. And because of the care that I have here, I work at Children's now. Um, so because of the quality of care that they gave me, I wanted to do the same for the patients that I would do now.
Miriam.
My name is Miriam, and I have two sons with hemophilia who are 22 and 18 years old, and they would absolutely deny that I have any right to be here as any kind of expert. So, which sort of leads into one point, which is that at the same time as we are asking our young adults to make this medical transition, our relationships with them are definitely transitioning and is a big part of the equation. So much good material has come out from the earlier speakers and from the panel here and the audience that basically anything I had planned to say is already covered. So I thought I'd just talk about some areas that were kind of stumbling blocks or were difficult for us. Money and insurance issues is definitely one. One piece of that is that you have to, in an age-appropriate way, start talking about insurance at a far earlier age than you normally would, and earlier age than people are developmentally ready to think about. Obviously, not every nut and bolt, maybe, but insurance is boring and it's confusing and it's really important. So you just have to kind of start talking about it. The other piece is that there is a real disconnect between the autonomy and privacy and then who gets the bills and the EOBs, and I just put that out there. It's you want your 18-year-old to be totally in control. I'm very grateful that I can pay the bills, that I can stay on my insurance, but it is a disconnect. In terms of other stumbling blocks, things that I've always been doing, it's easier for me to keep doing than to have someone else step in. It's something I still fight with. Similarly, explaining things that are second nature. So I, because of a bad bleed that one of my sons had at an early age, decided for me, I felt best keeping 6 doses of factor on hand at all times. I never wanted to go below that. I wanted to order before that. But I realized I just said, oh, order before you're below 6 doses, and I never really explained. And I'm sure maybe the explanation hasn't stuck, but the same idea of saying things or teaching things 5 different ways and 5 different times. And just there are things that we all as parents do without thinking about it that you maybe need to step back and think, why do I do it, and maybe try and make that explicit. Accepting that mistakes will happen, huge difficulty for me. And a little twist on that is accepting that my child's way of doing things may not be my way of doing things. That might not be a mistake. That might just be a difference. And I have to accept that because they are young adults. So that's a lot of generalities. Concrete tips. I was trying to think, since so much information was already gone over, what were some concrete things that we did that might be useful to know? Telling your story. Everyone has talked about how huge that is. We started when my sons were going into middle school. When they were younger, Chris came out and did school briefings for the elementary school, which was great. Starting in middle school, I went with my sons, but they did the briefing for the school nurse, and then they did for camps, and it was a learning, again, this process. None of this is either or, you stop one thing and start another. It was all a process. So it was a way of learning how to tell their story and get out the important parts and do it concisely and maybe not use jargon that we in the hemophilia world understood, but a school clinic nurse would not necessarily know, or a school principal. And again, for camp, and that was good training, because then when both of mine went away to college, they had to call the school clinic and figure out how they were going to get their factor shipped to them. And could they store needles and sharps containers in their room? And so they, this was a step that they were pretty well prepared to take, because they'd had lots of practice telling their story. Ordering factor, it was very helpful to start before they had to. So start while they're still at home and not when they're, for the first time, when they're away at college. Insurance card. Get your child an insurance card. This didn't really, and probably when they start to drive, because think about it, they're going to be driving. I'm not sure we did it quite that early. But we did it before they went to college. So if we're saying you need to be making your own appointments and so on, they need to have that insurance card. Locating the HTC. Chris is a resource. The CDC has a website. You can find all the HTCs in the country on the website. If you're traveling, the World Federation of Hemophilia has a passport program online. You can find HTCs around the country, around the world. Secondary HTC relationships. Both my boys went to college out of town, and so we got names either from Chris or from online, and they were responsible for calling the local HTC and establishing a relationship with them. That was a learning process for all of them. I didn't realize they would have to go in and have an appointment, and they did. And one of my sons was 1,100 miles away. The other one is local, but he can't have a car, and there's no public transportation in his town, and it's an hour to the HTC. But so again, it wasn't either or. We helped him out with transportation in that situation, but he had the appointment and so on. And the question came up earlier. In our case, it actually was very helpful that the secondary HTC was an adult one, because I felt like that did help the transit. I didn't feel like it made sense to establish a relationship with a new pediatric practice when these young adults were already 18. So I thought it was good that, in fact, the new practice was an adult practice. And then a final area that is a problem for me, maybe not for my sons, is that I have felt it's important to stay connected with the bleeding disorders community and to stay on top of new developments. And I have always done that, and I don't know if they're going to, but it is their choice, and I just put it out there. So.
I would personally say just ask questions and be as stubborn as the patient you're dealing with, because not everybody will want to open up as much. I didn't open up until, say, about 17 or so. I was actually in the middle of one of my crises. So about 17 or so, it was in the middle of one of my crises, and I just like blurted out. I was in the middle of depression too. I just like blurted out, I don't want to live like this. And then also blurting it out to actually help me to, like, it felt like I got a burden off of my chest, and then I just started to be more active in the way I handled my health too. So I just started to take more responsibility. Even like I was already taking more responsibility, but I didn't like say anything about it. I didn't say why I was doing it. I just kind of did it. So just be as stubborn as the person you're dealing with.
Make sure everything's bilingual. I think now it's easier for the hospital, everything's bilingual now. So I don't think that's an issue anymore. because either well, my mother was very active in making sure that she either brought someone who spoke English, or she was very understanding, asking layman's term, just tell me in layman's term what's going on, and she would be fine. But um, I think going back on what Irvin said, when you're in it, when you're like having a serious issue, that's when you learn to speak out, and that's when the provider needs to hear what we're trying to say.
I would just say it's not too late, and that it's a process, and one step at a time. So I don't know. I would say areas we're not doing as well. We're probably still too involved in making the appointments, or saying make your appointment. And the other thing is where to pick your battles. So we were just out visiting our older son, and someone is prophying late and is giving himself medicine later in the day than he knows he ought to. I mean, I know he knows that, but just as Dr. White said with her son going to the ER for a sore throat, me nagging him was probably not going to make that change in his behavior, and it would only badly impact our relationship. So I didn't. And I would rather he was taking his medicine before he went to work, but he's new at getting up, commuting, getting to work by 8:30, working till 5:30, and so maybe he will come of his own realization. So I think it's acceptance. It's which is very hard.
So what questions does our audience have for our panels? Because they're on the front lines.
I'm Dr. Craig Kessler. I work with Colleen and Lauren here at the Hemophilia Treatment Center at Georgetown. I'd like to make several observations that I've had through the years in dealing with transition. First of all, I think it's extremely important that patients have medic alert bracelets or some way of being able to identify what's going on with you in case you are in a situation where you can't communicate. This is particularly important to college-age children who go out and are independent for the first time. These medical alert bracelets can be ordered in such a way in which even the name of the physician that you're most familiar with and who has most of your history can be contacted to try to help any other physician who comes in contact with you for the first time. Make sure that you carry your insurance card. Make certain that you have a credit card, because most of the time when you go in to see your physician as an adult, you have to pay a copay. That is just part of the system, and you have to have some way of being able to deliver the copay. Most of our patients feel like it's an imposition to them to have to come back on frequent occasions when they're not feeling badly. But if you're going to learn about the disease, you have to be able to take the time to learn about the disease and the new therapies. And then one other thing that I think really needs to be taken care of up front is listening to Miriam talking about her sons. The only way that I think you can separate the parental patient relationship is if the child can learn from his peers. And so I would recommend that if your centers have peer groups, to make certain that your children participate in the peer groups. They will listen to their peers, whereas they may not listen to their parents. And we have those peer groups available in the transition portion of our programs between Children's and Georgetown, for instance, in bleeding disorders. And so take advantage of those. And if there isn't a peer group, have your child form his own peer group. We will facilitate that. We have the mechanism and the expertise with our social workers to be able to do that.
Thank you.